So, good afternoon, everybody. Okay, today I'm going to discuss a chapter of hospital waste management. We'll be discussing this chapter in two sections. In the first class, the contents of today's presentation is introduction, definition of biomedical waste, sources of healthcare waste, classification of healthcare waste generation, health hazards of healthcare waste, treatment and disposal techniques which are used for the disposal of healthcare waste. Okay. So coming to introduction, the terms called hospital waste, biomedical waste, healthcare waste are all similar. Okay. So this healthcare waste is considered as a high potential for infection and injury. So we have to have a safe method for its handling, its transportation and its safe disposal. Okay, so if there is any inadequacy in its handling, so there is causation of serious public health consequences as well as significant impact on the environment. So this management, the appropriate management of the healthcare waste is a crucial component both for the environment protection as well as the protection of the public health. So environmental health protection is considered as an integral, so this management of healthcare waste is considered as an integral feature of healthcare services. Okay. So coming to the definition of biomedical waste, this biomedical waste management and handling the Ministry of Environment and Forest is responsible for the formation of the rules for this management and handling of the biomedical waste. It was formed way back in 1998 and later on it is amended in 2000, 2005 and recently in 2016. So but according to it, the definition remains the same, that is, it includes any waste. The waste could be solid or liquid or any fluid, bodily fluids which is generated during the diagnosis, treatment or immunization of human beings or animals. It could be human beings or animals, or in research activities pertaining thereto, or in the production or testing of the biologicals. So the definition itself gives us a broad idea about what is biomedical waste and what waste to be considered in the management and handling of this particular biomedical waste management rules. Okay. So according to WHO, among all the biomedical waste generated, 75 to 90% is considered as non-hazardous, or it is also called as general healthcare waste because it does not cause any harm to the public, as we already known that it causes public health problem as well as it causes hazards to the environment. But 75 to 90% is almost non-hazardous. It does not cause any kind of threat. Whereas remaining 10 to 25% is considered as hazard. That is, they are the threat for the public health as well as the environment. So this must be handled carefully. So where do we get this healthcare waste? What are the sources from which we get? So what are the institutions which are involved in the generation of the biomedical waste? The government hospitals, the private hospitals, the nursing homes. Nursing homes are nothing but small establishments, healthcare establishments, and physicians' office or clinics like small OP basis, whatever the physicians do the daily evening OPs like that. And dentist office or clinic, similarly not only in the medical side as well as the dental side also, they generate the healthcare waste. And dispensaries are nothing but pharmacies where the medicines are dispensed. Okay, primary health centers, we know that the PHCs, the small government health establishments at the root level for the delivery of healthcare services. And what else are considered as the sources of healthcare waste? The medical research and training establishments, all this where they conduct experiments on animals or humans in drugs trials or vaccine trials. All these establishments are also considered as a source of healthcare waste. Okay, and mortuaries where the dead bodies are stored, and blood banks and collection centers where the blood is collected, and there is lot of waste generated when the blood is collected, when the blood is given to other patients and all. Okay, animal houses, these are nothing but the place where the animals are kept, especially for experiments, especially rabbits like that. We do experiments for pharmacology purpose, right? So for that, they are called as the animal houses. They are also considered as a source of healthcare waste. And slaughterhouses are nothing but the place where the animals are killed before they are sell for meat, whatever what the this meat we procure from the market, like mutton, beef, pork, all these are slaughtered in the slaughterhouse. At they conduct an antemortem examination, postmortem examination, and then they consider whether the meat is safe or not. So that slaughterhouses are also considered as healthcare waste, because a lot of waste is generated from the animals after killing them. The blood and all the unnecessary waste and all, they also should be disposed in a safe manner. And the laboratories, the labs, the diagnostic labs or research labs on this, and research organizations and vaccinating centers, the immunization clinics or the immunization centers in which is done in the villages or in the urban health centers, whatever the vaccinating centers, a lot of waste is also generated during the vaccination purpose. As we know, we saw in the definition, the waste generated during the vaccination also is considered as healthcare waste. Okay, and biotechnology institutions or production units where the lot of medicines or drugs are produced, that also a lot of healthcare waste is generated. Okay. So before going to healthcare waste, we have seen from where the healthcare waste, but what kind of waste is generated, and you have to be aware of what the names of the waste and what kind of waste will be included in the healthcare waste. So first one is general waste. I told you already, 75 to 90% of the waste which is generated in the so and so places which we told, like hospitals or dentist clinics or research organization, most of it is general waste. That is the administrative office where we have paper, plastic waste and all. And the cleaning and sweeping, we have a lot of leaves, filth and all. So all these are considered as general waste. Okay, next is the pathological waste. What is pathological waste? It's nothing but the human tissues or fluids where during surgeries, in orthopedic surgeries or the general surgical operations, the body parts are removed, and the blood and other body fluids, and in fetuses in the gynec operations, where all this they are ready for disposal. You cannot just throw them into the general dustbins. They have to be disposed in a proper way. So these all would be coming under the pathological waste. Okay, and next is the infectious waste. This includes all the waste which is known to contain pathogens. That is, it could be virus or bacteria or any other. So the lab cultures where you put where you use in the microbiology. Okay, and also the waste from the isolation wards. Isolation is nothing but the infectious wards where we take the swabs for blood collection or for nasopharyngeal swabs or CSF, whatever. So all these materials which come in contact with the infectious material from the patients, it could be blood or urine or any other body fluids. So whatever the material or equipment which has come in contact with the infected patients, and including the excreta, because it also contains the pathogens. So all this would be coming under the category of infectious waste. Okay. Next is sharps. These are the instruments which are sharp. So that all like needles, lancets, scalpels, infusion sets, the broken glass, blades, all this would be considered as sharps. These are used in a daily basis, right, in the hospitals. So these are all included as sharps. Next is the chemical waste. Chemical waste includes all the laboratory reagents. In biochemistry lab and all, you use a lot of reagents, right, for doing some experiments or doing some tests and all. And the film developments and the disinfectants as well. So the disinfectants which are expired or no longer needed are also considered as chemical waste. So all the acids, alkalis, all the solvents which are no longer needed, they are considered as chemical waste. Okay. Next is the pharmacological waste. This includes the drugs or vaccines which are no longer needed or expired drugs. They have to be disposed in a safe manner. You cannot just throw in them in the general dustbins. Okay. Next is the radioactive waste. This is very important because what waste should be considered as radioactive waste is that the waste which contains the radioactive substances. Where do we use this radioactive substance? In the radiotherapy. We use for cancer patients, right? Or even in research purpose. So all that in the radiotherapy, which is the liquids which are unused or the contaminated glassware, all this would be considered as radioactive waste. And not only that, all the patients, the urine and excreta of the patients who are tested or treated with unsealed radionuclides, who are patients who are undergoing the radiotherapy also should be, their urine and excreta is also considered as radioactive waste. Not only the radiotherapy materials, even the urine excreta of the patients treated or tested. For testing purpose also, we use radioactive substances, right? So in such conditions, those patients, urine and excreta is considered as radioactive waste. Okay, next is the pressurized containers. The oxygen cylinders which we use, the gas cartridges which is used for disinfection or inhalating the anesthetic agents, and the aerosol cans for disinfection purpose or inhalating anesthetic agents. All these are considered as under pressurized containers. Okay. And next is the genotoxic waste. This is very, very important because it is considered as a teratogenic waste and it is transmitted in the genetic material. Okay, it even causes cancers and causes mutagenesis in the person who is exposed to this genotoxic waste. So mainly the cytostatic drugs which is used in cancer therapy, the genotoxic chemicals, all these are considered, which are expired and all, they are considered as genotoxic waste. Okay. So, so the healthcare waste generation. So this depends, this is differing in different countries. It is not similar in each country. It varies from country to country, and also within the country also, how much waste is generated and how much the quantity and the quality of the waste generated is not similar. So we'll see what is on what factors does this waste generation depends upon. First is the established waste management methods. What are already the established waste management methods followed by the particular country? And what is the type, depending upon the healthcare establishment. So whether it is a government hospital or a private hospital or a small OP. So depending upon that, the waste generation varies. In government hospitals, you have lots of patients. So obviously the waste generation is very high. Whereas in a small OP like that, the waste generation is very less. Like that. And hospital specializations. As I already told you, the specializations like involving surgeries, the gynec specialities, general surgery specialities, all this, they have lots of infectious, the pathological waste generation. Okay, whereas the normal general medicine, like that dermatology, you have very less compared to them. So depending upon the specialization also, the waste generation varies. And proportion of reusable items employed in the healthcare. So what most of the items which we used in the healthcare is they're disposable, like needles or syringes like that. But usually in dental clinics, offices, we see that the instruments which they use are reusable. They sterilize and they reuse. So depending upon the items which is used in the healthcare also plays an important role in the we can say how much the waste is generated, and proportion of patients treated on a day-care basis. In some days, the OP may be very high. Some days, the OP may be less. And in clinics also, in old clinics usually we have lots of OP. Newly established clinics we have less OP. And middle and low income countries, they usually have less waste generation when compared to high income countries. Okay. Next, so whatever the waste is generated, I already told you, like we have classified it as non-hazardous and hazardous. Okay. So on a general survey, they have conducted different surveys, and among them, one of the says that the general waste is about 80% of the total healthcare waste generated, and remaining is 15% is about pathological and infectious waste, and 1% is sharps like needles, syringes, and all, and 3% is chemical and pharmacological waste, and less than 1% is special waste like radioactive waste, specialist containers, the broken thermometers and all, like used batteries and all. This is very less. Only in cancer clinics like that you can see that this radioactive material and all used, but in normal regular hospitals, the radioactive waste use is very less. Okay. So another survey which is obtained from 10 large hospitals during the period of 1993 to 1996. They have conducted a big survey in Mumbai, Kolkata, Delhi, and Nagpur, like high cities. They have conducted this survey, and in this they have come to the conclusion that paper was about 15% of the total waste, plastics was about 10% of the waste, rags, cloth, the torn cloth like that, that is about 15% of the waste, and metals, sharps, it is 1% of the waste, and infectious waste is about 1.5%, and glass is 4%. And general waste, it is more than half, 53.5%. So in most of the healthcare establishments, we can see that the general waste is always higher when compared to the other waste. And another survey which is done in Bangalore regarding the quantity of the waste, it shows that in government hospitals the waste is about half to 4 kg per bed. You can estimate like how many beds there will be in a government hospital depending upon that. It is about half kg to 4 kg per bed in government hospitals, whereas in private hospital it is half to 2 kg per bed. And in nursing homes, the small healthcare establishments, it is about half to 1 kg per bed per day. And total amount of hospital waste generated in Bangalore was about 40 tons per day. So among this, 45 to 50% is infectious, and the segregation of infectious from non-infectious waste is only done in about 30% of the hospitals. So it is very important to segregate the infectious and non-infectious waste. I already told you, like we should not mix the healthcare waste with the general waste, because it causes hazard to the environment as well as causes threat to the public health. So who are at risk of this healthcare exposure to this healthcare waste? Why exposure to this healthcare waste causes diseases or injuries? Because most of them are patients, they contain infectious agents. It contains toxic or hazardous chemicals or pharmaceuticals. We know that the drugs or vaccines is made up of very toxic or hazardous. We cannot just leave them into the general environment. We cannot just mix them with the water or soil. Okay, it contains sharps. It's very, it causes injuries. It may cause cuts where certain diseases like HIV, hepatitis B can be transmitted. And it is genotoxic, as I already told you. It is mutagenic and it can cause mutation of the genomic material, and it is also teratogenic. It can cause even in the baby as well. If any pregnant lady is exposed, it may cause teratogenic effects in the baby. and it is radioactive. Some the radiotherapy agents or certain radiotherapy drugs, they are radioactive. And non-hazardous or general waste as well, if they are kept like that, if they are stored like that, if it is not properly disposed as well, it attracts the flies and all, it causes other communicable diseases as well. So who are at risk of this health uh, who are at risk of exposure of this healthcare waste? Mainly the sanitation workers, the class 4 workers who are involved in the transportation, who deals with the healthcare waste. They are the one who transports, who carry that waste, they clean the things, so they are at high risk. And next are the medical and paramedical staff, the lab technicians or the nurses, the treating doctors, who are there also at risk of this exposure of this healthcare waste. So it has to be properly disposed. Not only them, even the patients and visitors. We know that the hospital-acquired infections. So these are considered as the healthcare waste exposures are again considered as part of the HAI, hospital-acquired infections. So the patients as well as the visitors are also at risk of exposure of this healthcare waste if it is not properly disposed. So we'll see what are the types hazards which we can have with the exposure of this healthcare waste. First is the hazards from infectious waste and sharps. So this may enter the body through a puncture, abrasion or cut in the skin, or through mucous membrane, through inhalation or through ingestion while having food. It may be contaminating the food which we eat. So it is not advisable to eat in the hospital premises, like in the wards or in the dissection like that. It's not good to have food in that areas. So even while giving injections like that, also we have to be careful so that we do not harm ourselves. So especially the contaminated sharps, it has, after giving an injection also, you have to properly cover the needle and you have to dispose through a needle cutter, shred off the needle and then dispose it off. So mainly, as I already told you, the HIV and hepatitis B, C viruses are usually transmitted by this contaminated sharps. And also certain bacteria which are resistant to antibiotics. Can you tell me any bacteria which are resistant to antibiotics which are commonly seen in hospital-acquired infections? Some examples are like methicillin-resistant staph aureus. You might be learned in your microbiology MRSA, and vancomycin-resistant enterococcus, and even multi-drug-resistant Mycobacterium tuberculosis. All these are bacteria which are resistant to antibiotics. So this may also contribute to the hazards which are caused by the poorly managed waste if they are not properly disposed. And next is hazards from chemical and pharmaceutical waste, the expired medicines, drugs and all. So these are very toxic, and not only toxic, they may also affect the genetic material, and some of them are corrosive. The chemicals, especially the acids, alkalis and disinfectant solvents, these are corrosive and flammable. They may catch fire and they're reactive, and some may explode and shock sensitive. So it is very important to dispose them off carefully. And some even may cause, the chemicals especially cause intoxication because of acute or chronic exposure, and injuries like burns also may be caused because of this chemical waste with catch fire and all. And disinfectants are usually commonly used in hospitals, right? So these are particularly important members of this chemical waste. So exposure from the hazards can be caused by exposure of this if not properly disposed, and they are used in large quantities and are often corrosive, the disinfectants. So the reactive chemicals may also again form secondary compounds, the toxic secondary compounds when exposed to air. So this is again, they may explode and cause burns and all. And hazards from genotoxic waste. The severity of this depends upon the type of the substance and how much time the person has been exposed to it. The extent and duration of exposure to this genotoxic waste. So exposure may also occur during the preparation or treatment with this particular drug or chemical containing this genotoxic material. So it is very important to be careful, and not only that, it through inhalation or absorption through skin or ingestion of food also accidentally the genotoxic material may be contaminating the food which we eat, or the skin our skin surface, or inhalation through dust or aerosols. So anything the exposure could be in any way. But the effects which are caused with genotoxic waste is very bad. It's better to avoid it. And hazards from radioactive waste. Here also the type of disease which is caused by the exposure of radioactive waste, it depends upon the type and exposure, how much time the person has been exposed to the radioactive waste. So if it is exposed in for a very less time, the symptoms could be headache or dizziness or vomitings like that. If he is exposed chronically for a period of months or days or years, so it affects the genetic material, the radioactive waste. And not only this, apart from all this, the public sensitivity. The human organs or the human fetuses, if they are just thrown like that into the openly, it is very scary to look. So the general public is very sensitive to the visual impact. So it is very hard to see. You cannot. Some people they cannot just see like that organs or like that dead fetus like that. So anatomical waste should be disposed of properly. So what are the different methods which are known for the treatment and disposable technologies for this healthcare waste? So these are the different methods which are available. First one is incineration and chemical disinfection, wet and dry thermal treatment, microwave irradiation, land disposal, and last one is the inertization. We shall discuss today these first three methods, its advantages and disadvantages, and where we can use them. First one is incineration. Incineration is a widely used method for most of the healthcare waste. I think in your fourth semester you have already visited the Maridi Valley, where we have shown you the incineration process, where all the hospital waste is collected and how they do the incineration process. So this is nothing but a high temperature oxidation process, where all the waste is dumped into a big combustion chamber, and all the organic and combustible matter is converted into inorganic and non-combustible matter. So all the waste which we dump in is reduced to ashes. So there is a significant reduction of waste in volume as well as the weight. So whatever the waste which we cannot recycle, which we cannot reuse, or we cannot just dispose of them on the landfill site. So all such waste can be incinerated. It's a very good method of choice for most of the healthcare waste. So here incineration, there is no requirement of pre-treatment also. That is, you need not convert that infectious waste or anything. You need not disinfect them privately, or you need not preheat it before sending it to the combustion chamber. So you can just directly dump all the waste into the combustion chamber and incinerate. But there is certain characteristics of the waste which we use. We cannot just, we have to follow certain criteria. I'll just tell you what is it. So this is the process. You can see here, this is the furnace where all the waste is dumped and the hot air which is also blown in. So here there is the waste is subjected to high temperature, and there is release of flue gas. Flue gas is nothing but the gas which is emitted from the burning of the waste. It contains mostly the nitrogen, CO2, and also some amount of oxygen, and also it also contains some particulate matter like soot and messy. Soot and SO2, sulfur dioxide, nitric oxides, even certain toxic gases are also eliminated. So all this would be included. We call it as flue gas, and this flue gas we would be sending it through the exhaust pipe. So this flue gas cleaning is optional. It is usually recommended that the height of the exhaust pipe should be more than 3 meters, so that it does not come in contact with the our breathing atmosphere. So from this we can, if the flue gas is taken clean, we get ashes and wastewater, and then it is exhausted to the atmosphere. And not only the flue gas, we also generate the wastewater and ashes from the furnace, which the ashes should be removed from time to time and disposed of. The wastewater, lot of wastewater is released from this furnace. This wastewater treatment is also optional, because if you can treat this wastewater, you can again reuse it. So whether for plants or other purposes, not for drinking, you can use the wastewater after treatment. And sludge, this, you know that the water treatment process, like there is the release of sludge which requires treatment before disposal. So this is the flow diagram for the incineration process. So there are different kinds of incinerators which are used. I will just know what are the different types. So the incinerators, the basic is like this itself. This is the basic process which happens in any kind of incinerator, but the types is different. So it could be a basic combustion unit having a single chamber which operates at a less temperature, or it could be extremely sophisticated or very having double chambers and high temperature or rotary kiln like that. So the range could be any, but the process is similar in any kind of incinerator. First one is the double chamber pyrolytic incinerator. So this is how it looks. There will be two chambers. Here we have a secondary chamber as well. So this is mainly, it operates at very high temperature, about 800 to 900 degrees centigrade. Here is that the secondary chamber, I told you, like there is emission of flue gas which contains certain particulate matter and certain harmful chemicals which is released to the atmosphere. Here is that in the secondary chamber, this flue gas is again treated and then released into the atmosphere, so that all this particulate matter is not released directly. So this is about double chamber pyrolytic incinerator. Here advantages with this use is that it has very high disinfection efficiency, and it is adequate for all kinds of infectious waste and most kinds of, even the drugs, vaccines, the chemicals which are explosive, which are toxic, can also be, we can just throw them off into this double chamber pyrolytic incinerator. But disadvantages, the cytotoxic waste cannot be disinfected here, and it is very high investment it requires. It is very costly. So this is about double chamber pyrolytic chamber, and this another one is the single chamber furnace. You have only this is the regular, this is like a basic combustion unit. So if pyrolytic incinerators are not affordable, because they are more efficient when you compare with the single chamber furnaces. So if that is not affordable, we can use the single chamber furnaces as well. So you have only a single chamber here, and directly the flue gas is emitted into the atmosphere. So advantages is it has good disinfection efficiency, and there is drastic reduction of weight and volume. So that residue, the ashes which is being produced, they can be disposed of in the landfills. So there is no requirement of highly trained operators. This normal, with the workers with minimal training can also perform this incineration process. So low investment, and it is considerably cheaper when you compare with the double chamber pilot incinerator. But disadvantages, I told you that there is no treatment of the flue gas, so there is significant emission of atmospheric pollutants into the environment. So, and there is need for the periodical removal of the slag and soot, that is the ashes and the soot which is deposited in the like the exhaust pipes. They have to be removed periodically. And thermally resistant chemicals and cytotoxic drugs, it is not it is inefficient in destroying them. Okay. And another one is rotatory kiln. This is again a very high temperature incinerator, more than that of this double chamber pyrolytic incinerator. It is about 1200 to 1800 degrees centigrade. It has a rotatory movement. So this causes decomposition of genotoxic substances and heat resistant chemicals as well. So those chemicals which are not treated in the double chamber, they can be treated in the rotatory kilns. So here advantages is that it is for all kinds of infectious waste, chemical waste, pharmaceutical waste, all kinds of waste can be incinerated here. Disadvantages is that it is very costly, obviously, because double chamber is only very costly. The rotatory kiln is much more very higher costly when compared to the double chamber. So please, the picture is not so clarity it's not having clarity, but still it looks like this. You have a rotatory kiln here, the primary combustion chamber which rotates, and then you have a secondary combustion chamber as well as. So it is have like it just rotates and incinerates all the infectious waste. And another one is drum or brick incinerator. This is like a very basic incinerator which can use for small for low settings like that. So with the drum, you know that there is big drums, the upper and lower the surface is removed and it is converted into like a furnace, or with the construction of bricks as well, as shown in this diagram. Here you can see drum, both ends is removed and it is clubbed. So in this way, here you have a one brick construction. They construct like this, and then here all the waste is dumped in. So here all the waste is dumped in. So this is a basic incinerator which is very cheap. So advantage is that obviously all the waste, the weight and volume is reduced. Very low investment and operating cost, but disadvantage is that it only destroys the 99% of microorganisms. You cannot kill all the, 100% it is not killed, and pharmaceuticals or chemicals is not, because it is just a drum, they may cause explosion like that. So you cannot destruct the chemicals and pharmaceuticals, and there is massive emission of black smoke, soot, this toxic flue gas and odors and all, ash and all. It is very high with this drum or brick incinerator. So what kind of waste we can use for incineration purpose? So the waste should have low heating volume. What is this low heating volume? What is heating volume? Heating volume is nothing but the volumetric heat capacity of a substance. That is the amount of energy required by a material in the form of heat for by one volume, by 1 unit volume of the substance to increase the temperature by 1 unit. So some we know that some materials, they can be easily heated, but some materials, they cannot be easily heated. Like paper, if you just throw it catches fire easily. But a wood, a log, like that, it does not catch fire easily, especially if it is raw, green, this thing, it does not cause. Whereas those which are dried, like that wood, they can catch fire comparatively with them. So the heating volume of the substances which are used for incineration purpose should be low. For single chamber incinerators, it must be about 2000 kilocalories per kg, and for double chamber pyrolytic incinerators, it should be about 3500 kilocalories per kg. And the content of combustible matter, whatever the material which we are throwing in for combustion, the combustible matter, combustion is nothing but those which can catch fire. It should be above 60%. And non-combustible means like they are not easy, they do not catch fire easily. The solid should be less than 5%. So it should be very less. And the fines, so fines is nothing but very small material that can be less than non-combustible. Fines can be less than 20%. The moisture content should be less than 30%. If it is damp full with water, the fire cannot act upon. So what materials we cannot incinerate? Pressurized gas containers, because the oxygen cylinders like that, they are very toxic and they can explode, and the incinerator itself can be damaged if it is exploded. So those waste which contains high chemical waste, and silver salts or photographic radiographic waste when used like in X-rays, the radiological department, they use usually that kind of waste. And halogenated plastics such as PVC. What is PVC? Polyvinyl chloride. So this is very dangerous because it contains toxic materials like lead, cadmium phthalates. So this is very dangerous. So this kind of plastics also should not be incinerated. And those waste which contains high mercury or cadmium content like broken thermometers, batteries, and lead-lined wooden panels and all this, those are also should not be used for incineration. Some other process should be used for its disposal. And sealed ampules, the drugs, the ampules containing heavy metals, those also should not be incinerated. Okay, next method of the method used for dealing with this healthcare waste is chemical disinfection. So chemical disinfection is nothing but use of chemicals for the disinfection purpose. So these chemicals, what do? They kill or inactivate the pathogens which contains. So this process results in disinfection but not sterilization. You know the difference between disinfection and sterilization. Sterilization is killing of all the microorganisms including the spores, whereas disinfection is only elimination or reduction in the number of the microorganisms, but it is even resistant to spores, that spores cannot be killed with disinfection. So using chemical disinfection it's not so good, but for some purpose, for some liquid waste like blood, urine, stools, or hospital sewage, they can be the chemicals can be added to make it as non-infectious. So even the microbiological cultures, sharps, they can be rubbed with the chemicals before disposing them off. So it's not so effective, but with certain limitations, we can use this chemical methods for disinfection. Okay, advantages is that under good operating conditions, it is a good efficient method for disinfection, but not sterilization. Okay, but some chemical disinfectants are relatively inexpensive, like this phenols, the sodium hypochlorite, this Lysol and all, these are the disinfectant examples, right? So these are inexpensive when you compare with incineration, that the incinerators and all. This is a very cheaper method. But certain disadvantages, it requires highly qualified technicians for operation of the process, like whatever the chemical disinfectant which we use, there is certain amount which we have to add for each purpose. So that should be known. So only the qualified personnel, lab technicians or nurses, they can use this method. Using hazardous substances that require comprehensive safety measures are required. So you cannot just use like that. So for pharmaceutical waste or chemical and other types of infectious waste, this is not a good method of choice for disinfection. So another method is wet and dry thermal treatment. So wet thermal treatment is nothing but the steam disinfection. Here we use steam for the disinfection process. Here, the infectious waste is first shredded. What is meant by shredded? It is cut into small pieces. All the waste is the anatomical waste or whatever. It is cut into very small pieces, and it is exposed to high temperature and high pressure steam. So whatever, like in sterilization we use the autoclave, right? So this is somewhat, this wet thermal treatment is similar to autoclave process. So advantages with this is environmentally sound, because you do not, with this process we do not release any pollutants into the atmosphere. There is no release of any ashes or any infectious water into the atmosphere. So this is a low investment, and operating cost is relatively low. But the disadvantages is that the shredders is subject to frequent breakdowns and poor functioning. As I told you, that the waste first should be shredded down. It should be reduced in it should be cut into small pieces. Then only this process is effective. So they may be subject to frequent breakdown. So functioning is little difficult. So operation is also qualified technicians only can do that. Not every person can do that. So this is not useful for anatomical waste. Anatomical waste ani. But anatomical waste kaadu, infectious waste vaatiki manam use cheyochu. So pharmaceutical chemical waste kuda it's not useful, because the steam anedi daniki pattali kada. Adi pani cheyali ante steam anedi daniki pattali. So anatomical waste ki, pharmaceutical waste, chemical waste ki, the steam cannot get into it to affect. So the waste which is not steam permeable is advocate for wet thermal treatment. So another one is dry thermal treatment. This is the technology which is used for dry thermal treatment is called screw feed technology. Okay, this is a non-burn dry thermal disinfection process. It's not like incineration. Here there is no burning, only dry method. It is here also the waste is shredded. The process is same. The waste is cut into small pieces, and it is heated in a rotating auger. What is auger? Auger is nothing but like a drilling machine. It contains spherical like turbines. It contains. It will be rotating, and there it will be heated. So here, as the waste is shredded, it is reduced by 80% in volume, and 20 to 35% weight is also reduced with this dry thermal treatment method. So for infectious waste, sharps, we can use this dry thermal treatment, but not for pathological or cytotoxic or radioactive waste. This dry thermal treatment is ineffective. Okay. So these are about the 3 different methods: incineration, chemical disinfection, and wet and dry thermal treatment. So please read this topic. This topic is very important, not only from the examination point of view, but as future doctors, you will be treating the patients. So not only treatment, diagnosis అన్ని చేయడమే కాదు, ఆ వచ్చిన వేస్ట్ అనేది కూడా ప్రాపర్ డిస్పోజ్ చేయడం అనేది మనకి చాలా ఇంపార్టెంట్. బికాస్ దానివల్ల కూడా మనకి చాలా జబ్బులు అనేవి వస్తుంటాయి. మన చుట్టూ ఉన్న పేషెంట్స్ వాళ్ళకి కాదు, ఈవెన్ ద ట్రీటింగ్ డాక్టర్స్, sanitation workers. So the doctors should be having good knowledge on how to dispose this hospital waste. So in the next class, we will see what are the different methods and what are the bins in the hospital. So please have a reading in your PARK textbook so that you'll understand it better. So also read about the biomedical waste management and handling rules 2016. This is you can surf in the net. So what methods, what are the different rules which are coming, and also in COVID-19, what are the biomedical waste management. Running kuda COVID hospitals. So ikkada ippudu elaga waste anedi ee waste antarni deni waste ga consider chestunaru, aa waste ni ela dispose chestunaru anta kuda meeru okkasari just do an exercise. సో ఇన్ ద ప్రెసెంట్ సిచ్యుయేషన్ లో హాస్పిటల్స్ ఎలా చేస్తున్నాం అనేది కూడా మీరు చదువుకోండి. We'll just continue this in our next class. Okay, thank you.